there's been a recognition that a lot of the cancers that we're seeing now are actually not related to smoking and drinking, and we're seeing an increasing number of patients with virally related cancers. So cancers at the back of the throat, the tonsil tissue specifically, the back of the tongue and the tonsils, traditional tonsils that we're aware of on the side walls, and it's due to a virus called the Human Papilloma Virus. Now everyone's often, people are quite aware of the Human Papilloma Virus, particularly women, because it's the virus that causes cervical cancer in women. So cancer of the vagina, cancer of the cervix and the womb, so or the uterus. That virus is now started to cause problems in the oropharynx, and it's the number of patients who are developing that problem is increasing significantly. And there's been not very much publicity about it. It's hard to get traction, probably because we know that it's definitely a sexually transmitted disease. People might feel uncomfortable about that, but that's the bottom line. That it tends to affect males more than females, and the sort of group that are in the centre of it all are right about my age group. So I've got patients from their 30s through to their 80s who have had HPV-related cancers, who've been non-smokers, drink a minimal amount of alcohol, and they've just developed this out of the blue. And it's often sinister because they don't have many symptoms. They might just present with a lump in the neck. The good thing for all these patients is that they're likely to be cured, and it's one of the few cancers, even though it's an evolving cancer or it's increasing in incidence, the one good thing is that you can almost certainly say to the patients that they'll be cured by their treatment. And their treatment might be surgery with the Da Vinci robot, which is a great treatment because often, because we treat down the throat, but we also have to remove lymph nodes in the neck. And the alternative is that they have radiotherapy and chemotherapy, which are again all good treatments. But for some patients who are particularly young and have very early cancers, or anybody who has an early cancer, the surgery can cure them of the cancer, and they don't need any other treatment, which is fantastic, and which is really where the robot comes in. And really every patient who has an oropharyngeal cancer or an HPV-related cancer really should be offered the alternative of a transoral robotic resection of their tumour. It doesn't happen, and the public don't really understand it at the present time, but and there's not a great number of surgeons who are well trained in doing it presently, but the numbers are increasing.